Welcome, everybody. Thank you all for coming. Thank you for your patience. It seems like we always have Zoom issues. Welcome, everyone who's on Zoom with us today as well. My name is Paige. I'm the Charitable Giving Manager here at Vivalon, and I'm one of the people who sets this up. Anyway, thank you all for coming and joining us for our workshop today on taking care of business before you can't. I also want to thank our sponsors. We have sponsors that help us bring this content to you every month. Our estate planning series is sponsored by Valley Memorial Park Cemetery and Funeral Home here in San Rafael and Carrie Spence Estate Plans. And next month, we do one of these every month. And next month on June 18th is Carrie Spence will actually be here and we'll be talking about estate planning, and we'll also have a financial advisor here. So keep that in mind if you want to grab one of these on your way out as a reminder, and you can call or go online and register for that. That one will also be hybrid on Zoom as this one is. Before we get started, I'm just curious, is there anyone who's here today who has not been in our new building yet? Oh my goodness, quite a few people. Well, welcome. We're really glad to have you. Thank you for coming. I encourage you to please come back anytime Monday through Friday, 9 to 5. I think it's every Monday through Friday. And people at the front desk will be happy to help you. We have over 60 different programs every month. We have all kinds of classes. We have a lot of fitness classes, falls prevention classes, digital literacy classes. We have ping pong, we have mahjong, and we have a yummy cafe that you can come and have lunch and bring some friends and have lunch too. So you can grab one of these on your way out. It's our monthly newsletter, and it will have some of the classes that we have in here. And please just drop in. You don't have to make an appointment or anything. Come by. We'd love to give you a tour and show you around and answer your questions. So welcome our newcomers. Today's workshop is part of our monthly estate planning workshop series. So we bring a different topic every month that's related to helping people stay financially stable during their retirement years. So we know that one of the most important tools we all need is a will and trust. So we do have a partner that helps us with that. It's called Free Will. It's online. It's on our website. Unfortunately, I can't show you our website today because of our Zoom problems, but I will send some information out in a follow-up email that will show you how to log on and look at that. The Free Will and Trust tool is 100% free. They don't even ask for a credit card. It takes about 20 or 30 minutes to do. Even if you have a will or trust already, it might be a good way just to get all of your information organized. So if you do want to go see an attorney, or you don't have to, depends on your state to what you have. The more complicated it is, the more likely you'll need an attorney. But Carrie Spence will be here next month, and she can answer a ton of questions about that. So if you're not signed up for that, I encourage you to do that as well. Let's see. Couple of just quick tips before we actually get started today with our presentation. For those folks on Zoom, if you have questions, you can type your question in the chat, or we'll ask the question on your behalf, or you can raise your hand or your Zoom hand. And Juliet, my colleague, will help you facilitate those questions. For those folks in person, I will be coming around with this lovely microphone. So if you could hold your question till I get to you with the microphone so that the recording will pick up your question, and people on Zoom can hear it. You won't be on Zoom, just your voice and your question. So with no further ado, let's introduce our wonderful speakers today. First up is Barb Lyon from RelyOnB. She's the founder, and she helps clients manage everyday financial tasks such as bill payment, tax prep, coordination, organizing important paperwork, bringing clarity and consistency and peace of mind to their financial lives. Today, Barb will outline the practical steps to take to ensure your financial documents and key personal information is organized and accessible so that your wishes are honored and your well-being is protected. After Barb gives her presentation, Carolyn Tucker from HomeWell Care Services will lead a practical discussion on planning ahead for in-home care, the benefits of using a licensed home care agency, the risks of hiring privately, and how early planning can ease the transition as care needs evolve. Carolyn's the co-owner and vice president of business development at HomeWell Care Services of the North Bay. It's a California state licensed home care organization. And with both personal caregiving experience and professional expertise, Carolyn is dedicated to helping older adults age safely and comfortably at home. So I am going to stop sharing and turn this over to Barb. There we go. So let's give a big hand to Barb. Welcome. Thank you, Barb, for being here.
Hi, thank you. Can everybody hear me okay? All right, great. Hello, people on Zoom. Okay, so real quick, get ready here. Okay, so I'm Barb Lyon. My company is RelyOnB, and I'm what is known as a daily money manager. And I'll tell you a little bit more about what that is. First, a little bit about me. I spent 12 and a half years at FedEx after college when nobody was hiring teachers. And I then jumped into the startup world, and I was in the technology startup world for 20 years at 9 different companies, started them up, shut them down, everything in between. And then I started my company, RelyOnB, about 7.5 years ago. And I am a member of the American Association of Daily Money Managers. Most people have never even heard what a daily money manager is. Primarily, we are kind of the day-to-day bill pay, support people, help people make sure their taxes get done, make sure their bills are paid, make sure that they're not subject to scams, lots of different kind of decoding the mail. When the mail comes in, it starts getting a little confusing. I help with that and hopefully prevent my clients from getting scammed in any way. I'm also a member of the Professional Fiduciary Association. In California, we're really lucky. We actually have a licensed fiduciary network, and fiduciaries are licensed by the state, and they are licensed to be a power of attorney or an executor for families. And the rule of thumb is if you're not a licensed fiduciary, you're really not supposed to be a power of attorney for more than 2 non-family members, because now you've kind of started a business, and that just starts to get a little messy. So the fiduciaries, we have a great group in Marin and San Francisco and all over the state, and I work very closely with them to provide services for clients who don't have family to help. And lastly, I'm a member of the Marin Section on Aging group, which is an awesome local group where we focus, a bunch of different service providers focus on helping seniors in lots of different ways. That's where I met Carolyn 7.5 years ago. And the group really just helps each other with clients, helps servicing them. We do a lot of learning in the group where we have different experts in elder care come in and speak to us. And so it's a really, really awesome group. So I'm happy to be a part of them. So why am I here? Why RelyOnB? This is my mom. She's 92 in this picture. She passed away 2 weeks after that. But I started working with her in her early 80s. She lived about 3 hours away. I would talk to her on the phone. She would read me the mail. She would say, do I save this? Do I believe it? What do I do with it? So we kind of got into a little routine of rip it up, put it in my cupboard, or do something about it. we did that remotely for years, basically 8 years. And so that's how I got started, actually. And a lot of people in my field, that's how they get started. They started off by helping a family member and realizing, wow, there are a lot of people out there that don't have somebody to help them. Right now, seniors will comprise more than 20% of the US in 2030. It's only 5 years from now. There's a lot of us, and I am technically a senior as well. By 2034, older adults will outnumber children. 2034, 9 years from now. Seniors currently, and actually these statistics are from 2022, seniors are going to comprise 22% of the population in Marin. So in Marin, we have a lot of people who are in that position where they need to start thinking about taking care of business while you can. And that's why Carolyn and I are here, is to really talk about that. So my aha moment was, who helps somebody who doesn't have family, who doesn't have anybody to call? That's why I got started. If I wasn't able to help my mom, I don't know what would have happened. I have a brother in LA and a brother in Paris. Neither of them got the organizing gene. Neither of them would have been able to help even if they wanted to. Okay, so one of the first things that you really want to think about is picking your team. We need to surround ourselves with people who can help us as we age. And as I pick my team, I have a lot of people that I use for resources to help my clients. I've used Carolyn numerous times, her services for caregiving with my clients who suddenly need more caregiving. So we all use a team approach with our clients. So a healthcare advocate, who's going to be that person that speaks on your behalf when you can't? Yes.
I just wonder.
Hold on.
Handing out a paper telling us what you're talking about.
I am not, but I'm
okay.
happy to share it with you. I can get your information. And the question was for Zoom people. I'm sorry. I don't have any paper that I'm handing out today, but we can make arrangements for that.
We can also send a PDF with the follow-up.
Yeah. Thank you. Yeah. So your healthcare advocate is your power of attorney. That is an old term, power of attorney for healthcare, power of attorney for finances. It got very confusing. So when I can't remember her first name, the person coming next month who's going to be speaking, the lawyer, she'll actually use the different terms that are titled on the documents. But your healthcare advocate needs to know what you want. So I leave here, I step off the curb, I fall, I hit my head, I'm unconscious, get rushed to the hospital. I can't speak for myself. My healthcare advocate, my person, needs to know what I want. Do I want to be kept alive if I'm not going to return to my normal self? Do I want to live in an assisted living place with a garden or next to the ocean where I can, excuse me, see the ocean? What do I want for my care? So your healthcare advocates, the person that's got to be kind of personal, and you got to talk about it. Sorry about my voice. Power of attorney for finances. This one's a little bit less personal. It's somebody who's going to step in for you while you're alive to make sure your bills get paid. So like for my mom, I was actually both people for her, because I was a lot more local than my brothers, and also I could manage the finances for her. But what it required was me knowing how to do that. So we're going to talk a little bit more in detail about the things that you can do to help prepare your advocates, both your healthcare and your finance advocates. Your executor. So fiduciaries are often executors for estates and wills when the person doesn't have any family. And in that case, if you have a really good estate plan or will, your executor is just following your wishes. They're just following a to-do list. If your estate plan isn't very specific, there are a lot of decisions that need to be made that would have been really helpful if you had articulated them in your estate plans. So executors are it's more of a business transaction. The trust says, do this, do this, do this. Sell all my assets, split all that money up with these people and these nonprofits. If it doesn't go into a lot of detail, though, what happens when somebody passes away that you were going to give that money to? Does it go back into the pile for everybody else to split? Or what's that executor supposed to do? So that's an example of not being specific enough about what it is you want. So the theme for me today is really about making sure you've expressed your wishes, making sure that you've articulated it in writing and to the people that matter, the team that you've put together. Your estate lawyer. Doesn't have to be some big, fancy, expensive estate lawyer. Everybody just needs somebody that will help them draft the documents. And in some cases, but not always, when you pass away, that same estate lawyer that drafted the documents would be helping the executor shut down the estate. There's a dirty little secret out there. If we don't know where the trust or will is kept in your house or in your safe deposit box, it's as if it doesn't exist. There is no file cabinet in Sacramento that has Barb Lyon estate plan when she passes away that somebody pulls out that we work on. So all the work that you're doing right now, and I'll keep hammering, excuse me, keep hammering this point, is we need to share this information with our team, because that estate plan and that will could be buried under encyclopedias and you pass away and nobody even knew it existed. And then the state proceeds with settling your estate without your wishes. So I'm going to be repetitive here, but it's just so important. I had a situation, started working with a client it was like late March, early June. The wife stands up, falls, hits her head, dies instantly. Husband has no idea where the will and the estate, the trust is. We proceeded as if there wasn't one. After we emptied the house and moved him out to an apartment, we found it. It was null and void by then. Now, thankfully, he was the survivor. He was inheriting everything, and there really wasn't a big deal in this case. But there's nobody to run to. We didn't even know who the lawyer was that drafted that document. So again, this is just all about getting this information in a place where you can communicate it to your team. The question is, where should it be? So we'll talk about that. There's a special place that we can make it up, but we'll talk about where all this can be. Good question. Your CPA. I end up inheriting clients where I don't even know who used to do their taxes. I don't have a tax return from the previous year to even compare. I take those clients to my CPA and we figure it out together. But having your CPA means it's really easy for your kid or your executor to go back to that person who knows your history, who can make sure the taxes are paid. And in this case, that's for both while you're alive, your power of attorney. If you're unable to do this stuff for yourself due to dementia or any kind of brain injury, I'm doing it for you. But without any trail, I don't know who to go to. So these are the things that we kind of just automatically do in our lives that we don't really think about how important it is to have this carryover of information. Care management. So Carolyn's going to dig into this big time, but really care managing, where assisted living, like planning ahead, thinking about where you might want to move if you had to. 99.9% of the people want to stay in their homes. We all want to stay at home. My mom wanted to stay at home. At a certain point, Mom, we can't afford to have you stay at home. So we need to go to an assisted living place. Years before, I had taken her on a couple tours. So she had an idea of what she liked. So she would know, yeah, that place, that's the place I want to go to if I have to. I don't want to. She kept saying, I found like scraps of paper everywhere that said, remember, I want to stay home. They were all over in every room. But, eventually life took over and that wasn't to be, but she wasn't there for a very long time. So care managing is a really big part of your team, and thinking about that in advance is really important. Lastly, neighbors. If you don't have family, have neighbors, have friends, have somebody you trust who can help you. I just started working with a woman. She's in her mid-70s. She has dementia. Her family lives in San Diego. She doesn't have anybody locally. 5 neighbors on the street called one neighbor to say, we're worried about her. We're seeing this kind of behavior and we're really worried. That neighbor jumped right in, started getting her to the doctor, started making sure she was eating, got in touch with her family. She still never even met the family. It's just all been by phone. She's been a superhero for this woman. She's about 8 years younger, 5 years younger. So having people, we kind of tend to get more, we shut down a little bit in terms of socializing. We don't want the neighbors to know what's going on at home if it's not great, and we get a little embarrassed. It's the last thing you should be doing is really counting on people nearby who can help you. And then family is family. You got to figure out who's the right person. Please, and you'll learn more about this with the lawyer, please don't leave it to the 5 children to all decide together. It will never go well. Even the 3, you can't. 3 people, they have different ideas of the way mom and dad should be managed or handled or taken care of. They have different ideas about the money, and it will never work when you have 3 people trying to decide. Sometimes it works well with 2, but they have to come from the same place. Economically, they got to be pretty even, that one doesn't need the money more than another, or one doesn't have an ulterior motive to move in with mom, right? So you really that's more for the conversation with the lawyer, but think about when you leave people in charge, don't try to be nice, be realistic. Oh, I don't want to hurt their feelings by having one versus the other. I'm the middle child. Keep doing that. I'm the middle child. My older brother was like, wait a second, why are you in charge of everything? Because I'm the girl, of course, and I'm local, and I know how to do these things. So, it took a second for him to get over the fact that he wasn't large and in charge, but it worked. I was much closer to my mom. in vicinity as well as just in communication. Okay. Do it for those you leave behind. All this work we're going to talk about, we're going to get more specific now, is just really think about the people in your lives, the legacies. Even if you don't have family, you've got charities, you've got different people, you got, maybe you had dogs your whole life and you want to leave money to the Humane Society. Well, one way to make sure that happens is by making sure your documents are written accordingly. All right, now we get into the blocking and tackling, getting organized. I'm going to just ask a quick raise of hands. How many of you are still, how many of you are living in assisted living type of situations? Anybody here? Okay. So what that tells me is most of you probably haven't moved in a while. So you might have 20 years worth of tax returns. 30 years. I have one client who's 83. She has every single tax return she's ever filed in her garage. She thought it would be fun to go back and look to see how much she made over the years. She never did. She never has. And it's just piling up. So please, now's the time to get organized and to just make it easier on you, as well as make it easier for your team, your people. So it's time to purge. Get rid of those statements. You don't need PG&E statements from the last 5 years. Your cell phone bill, as long as you've been paying and it's up to date, nobody's going to come ask you if you paid your Verizon bill from 2023. There's just no reason to have it. And there's a lot of shredding community services. Some of the realtor offices will offer shredding services. There's shredding services that will drive up to your house and take the boxes for you. I'm happy to share that information with you. But please, now's the time while you can, that's the theme, to purge. To downsize the paper. There's a lot. Yes. Question.
You also talk about digital
I
records.
do. Yes.
Are you going to do today or?
I am.
Oh, good.
Way down there. And Paige, I never looked at the time. I'm doing okay. We failed. Okay. All right.
The fire department also recommends getting rid of all those old boxes
Yeah.
of paper, because if your roof catches on fire or the garage explodes, that it's just more dynamite having that there.
Yes.
And this, like you said, there's no need.
There's no need. Some CPAs will say 3 years for your tax returns. Some say 7. I use the 7-year rule because I'm making a recommendation to you and I don't want to get caught. So you should just ask your CPA what they recommend. But you, one of the things you do want to keep is any kind of house sale paperwork. So you don't need to keep the refinance paperwork because you're just basically trading loans to different entities. But you really need to keep your sale paperwork. The house you sold, the house you bought, the house you sold, the house you bought. You want to keep that.
There we go. I'll add this last weekend. I purged my own old bank statements and
Yay!
PG&E bills and my Verizon bill. It felt great.
Yes. Yeah, we got a question over there. Well, you're heading over there, Paige. Another point. Make sure that you don't have unopened mail laying around. That's really a sign for me and for my caregiver friends that things are starting to decline for a lot of clients because they've stopped looking at the mail. And that means checks that are coming in the mail. That means statements. Open it. if I know I don't want it, it doesn't even make it into my house. I hit my recycling bin on the way into my house and rip things in half and throw it away before it gets in the house. And I rip everything in half that I don't want. So it's very clear that it doesn't belong. Yes, question.
So regarding the tax documents, I have my own business, so I understood I should be saving a lot of statements and, credit card statements and all kinds of stuff.
Yes, I believe 10 years for your business
Mhm.
and 7 years for payroll, any kind of payroll information.
Thank you.
Yes, you're welcome. Oh, did I do that? I don't know how that happened. Whew. Okay,
We have a quick question from
Yes.
Zoom. For mutual funds you bought years ago, don't you need to provide the tax basis when you sell it? That wouldn't always be in the year-end statements.
that's a good point. What I would do to double check, that's a really great point, is to go online and check to see what you've got, what you have online. A lot of the brokerage firms will have that data, and so you don't need to keep the paper. All right, I gotta get going.
I'll try.
Okay. I had a question when you're talking about old bills. So I understand PG&E, water, those, so does that mean I don't need to even save it, like as soon as you pay it, just throw it away
I save the current year,
the current year?
and I always save a hard copy. For those of you who do your bills online, always have at least one hard copy on hand. So when Russia breaks our internet, we still have our account numbers and we still have our information as to who we pay, how much, and what our account numbers are. It's a bad joke, but so credit card bills are a little different because they have a compilation of so many different things. So charitable donations are on those credit cards. So those likely, unless you don't have the letters, if you have letters from the entities, really don't need a statement, but you need something for that same tax period. If it's related, if there are purchases related to taxes, you keep it for that same. Yeah, you're welcome. Okay, I gotta hurry up. Okay, list of all your financial accounts. So I've walked into homes, I don't know the person, they have no family, I have no idea where to start. It's a big scavenger hunt. Don't do that for your family. Don't do that for your person who's going to help you pay your bills. If I'm laying in the hospital and I can't speak and it's temporary, my person, my power of attorney needs to go into my house and pay bills and make sure the trains are still running. This is step one. So this is list number one that you really need to do. And I can share this information so you don't need to scramble and scribble. Note how your bills are being paid. This lady that I just started working with has 6 different checking accounts. I have another client that probably has 10 different credit cards. It's like makes my head blow up. It's too hard. It's too hard for me. It's too hard for everybody. Now's a good time to downsize if you're carrying wads of credit cards and lots of different bank accounts. Do that for your family. You don't need that many. All right, hurrying up. Accounts. So here's a tracking document. There's nothing fancy about it. I'm happy to share it, but it basically just lists all the different entities that you might have servicing your home, vendor name, account numbers, login information, and your contact person. If you have a contact person, that makes life so much easier. Make a list of important contacts. Who do I call? So this neighbor, thankfully, was able to like get the lady didn't, her cell phone wasn't working and her home phone wasn't working. Everything was shut off. There was no way for anybody to get a hold of her. We've done the scavenger hunt. We found the brother's name. We found the stepdaughter's name and number. Make it easy. I have a list of the friends to call when something happens to me because they don't live here. So like it doesn't, you don't have to be older to really make good use of having this information for your people. Again, nothing fancy. Document your digital life. There's a lot going on there, and it lives on if you don't shut it down, or if I don't shut it down for you, and me being your in place of your person. So we need your logins, we need your passwords, we need to know what sites you're on. We don't need to know the Hallmark card site. Not so important. They'll keep sending spam. You've been gone for 10 years, it doesn't matter. But we do need to know the important sites. We want to get you off of any social media because that's where identity theft kicks in. We want to get you off of email. She's got a question. We want to get you off of Facebook.
For those of us are here that do have information and a life online, how do we make sure that the sensitive information is safe? So if I have my bank account and, you know, on the list that I've got online and I've got the password in there, it means there's a certain risk involved. So any ideas?
Because you have it written down. You mean the piece of paper is a risk?
No, actually a piece of paper is safer than having it online.
Yeah. No, I wasn't saying put it online. I was saying these are the accounts that,
At least based on my experience with clients I have of my own, not these kind of clients.
Yeah.
But I teach computer skills for older people.
Yeah.
And those are the ones that maybe think it's okay to have their social security password online, but it makes it very vulnerable.
Are you saying where they save it onto their computer? I see. Yeah, that's a whole another ball
is.
game I gotta
It is. It's a
dig
big
into.
thing. But I think maybe it's just worth mentioning that it's a risk, not telling how to do it, because that would be a whole nother class.
Right.
But just to mention that it's, if you have it online, like your passwords, and not encoded in any way, it's a risk.
Right, right. And there is a whole nother class on how to protect your passwords and keep them safe.
Really good class.
Yeah, yeah. You and I can collaborate on that one. Okay, treasures. What about your treasures? You spent your lifetime collecting all these cool things, and your kid shows up, puts them in a box, and puts them on the curb and says free. What? That was my great great grandmother's something or other. So document it. It doesn't have to be everything in your house, but I bet you have a handful or a small box of really cool things that you want to give to somebody. I have like 30 nieces and nephews. I don't have any kids of my own. I've just decided what they're getting. I don't care if they really want it. It's my way of saying I was thinking of you, and this is the story behind the thing I'm giving you and why. So it doesn't have to be of great value, but I've had to go in and empty houses where I had no direction, and I went off to sell it and to donate it and to give it to people that could use it. An entire house, Carolyn and I worked together on it. Amazing collection of all sorts of cool things, not one note about what to do with it. It was heartbreaking. So don't, think about these things. All right. Don't forget your fur babies. All right? It doesn't have to be in your estate plan. This is my guy Buster. He passed away in July. But you do want to state somewhere in your documents, in this special place we're going to put the stuff, and say who's going to get it. Get your animal. Okay. Make sure you make a provision for that. I've had to give away cats. I've had to take them to different places that foster them and then find new homes for them. Again, no direction. Okay. You decide. This is why we're here. It's for you to take charge of what it is you wish. Where do you want to live when you can't live at home? Do you want to be looking at a garden? I'd love to be looking at a tennis court personally. Not likely there are going to be many assisted living places with tennis courts. Never know. Do you want cremation? Do you want burial? Do you want natural burial? Do you want to be buried in a mushroom suit under a tree? Cemetery. Do you want your ashes scattered? Do you want a headstone? All these things. Do you want a funeral service? Do you want a celebration of life? Do you want to throw a big party? What help your people know how you feel about these things, because there's nothing worse than not having any idea and being in charge of the very last statement or legacy of a person I didn't even know. Okay. Talk to your healthcare advocate. Let them know how you feel about life. Personally, I'm about quality over quantity. I don't want to be 105 unless I can play tennis. It won't be very pretty. Talk to your power of attorney on finances about how you feel about, do you want to save all your money for your beneficiaries, or would you rather stay at home and maybe use every last penny to be able to stay at home? I have a gentleman just like that now in Palo Alto. His wife passed away. He's burning through his full-time 24/7 care, $30,000 a month. He will burn through it. We'll do a reverse mortgage. He'll stay home. He's living like a king. He doesn't care that he leaves anything to his beneficiaries. But he and I have had that conversation. So if you don't have a conversation, that's probably not the way somebody would help you. All right, very last one, two. Where can you put it? So some people call this the love drawer. It's a little cheesy for me. I have a client that calls it the keys to the kingdom. But find a place, tell your people, you don't need to put everything in the drawer. You just need to document where they can find things. So you don't need to have the deed to your car in the love drawer, but you do need to say where I can find the deed to the car. Is it in the safe deposit box, or is it in a file? Is it in the car? Bad idea. So you definitely want to specify. Bonus points: iPad, phone, laptop. If I don't have the code to your phone, I have to throw it away. I have a brand new iPad from a client. Nobody knows the code. Apple will throw it away. They'll recycle it. Those codes are not breakable. So if I can't get into your phone, which likely has all your contacts and the key people, we are really, really stuck. So make sure in this situation that your people know where to go to that drawer to get those codes. So important. Your PIN number. Everybody's got kind of their favorite 4-digit PIN number. Mine's my anniversary. I can't Google my anniversary. Make sure it's not a number like the year you were born. I was born in 1958. what's the first thing people would do? Google, when was I born? Boom, I know her PIN. I can get into everything in her world. So make sure your PIN numbers when you use them for AT&T, Verizon, Fast Track. It's like breaking into a bank trying to talk to anybody if you don't have these PIN numbers. Again, your people can't cancel Fast Track without that PIN number. It takes a death certificate and a letter and phone calls, and it's just crazy. So, an extra house key. Have a friend who fell, broke her hip. Her person, her power of attorney, couldn't get in the house while her friend's in the hospital. So there was no way to figure out what needed to be done. So your people need to know how they can get in to help. You're not going to necessarily be there to open the door. Safe deposit box, key in the location. We get charged on our bank statement for the safe deposit box, but it doesn't actually say where the box is located. I've got a key I found on the top shelf of a garage. Awesome. I have no idea which Wells Fargo branch this 75-year-old set up his safe deposit box. We think it might be in the city, but we don't know. So you have to specify these things. The pink slip, the car title. I called it the car deed, car title. And your deed to your house. And if you've got a storage unit, try to downsize it now while you can, because you can help go through it and decide what's of value and what isn't. And also, where is that storage unit and where is the key? Okay. Fear does not stop death. It stops life. Worrying does not take away tomorrow's troubles. It takes away today's peace. Planning ahead while you can will get you so much peace. So I've eaten into Carolyn's time. I'm really sorry. Yes, sir. Okay.
Left. Can everyone hear me?
Yeah, but the
Okay.
people on Zoom can't.
If you have property that you purchased or you inherited, it's probably worthwhile checking the deed. We have an example of some inherited property where in the transfer of the property from a family member to another family member, the deed got scrambled up, and the description of the deed in terms of bearings, angles, and distance was incorrect. And so was fortunate that we caught it early on, but after a number of years, those things get very difficult to correct.
Yes. And without the people that originally did it, it makes it really, really hard. And it takes so much time to solve. So thank you.
Welcome, Carolyn. HomeWell. HomeWell.
Okay, can everybody hear me? Yes, okay. So thank you all for coming. Barb, great presentation. And actually we have worked together. Both she's brought me in for help for caregiving, and then reversely, we had a client who was not in touch with his family rarely, and things were progressing and he had lost his partner, and we just needed to wrap our arms around him, and Barb helped us do that. So my name is Carolyn Tucker. I am the co-owner and vice president of business development for HomeWell Care Services. We are a California state licensed home care organization, and I'll go into licensure more as we go on. Barb mentioned how she is part of the Marin section on aging. I am also part of that group and on the leadership team. It's a fantastic resource, and the community is welcome to come and visit there. Meetings are held every third Thursday at the Redwoods in Mill Valley. And so if you check out the Marin Section on Aging website, it will have information about the speakers that are coming in the next meeting. I am also the president of the Marin Home Care Organization. It's a nonprofit comprised of licensed home care, home health, and hospice. So all the entities that help people in their homes. And our mission is to explain to people all the benefits and safeguards of licensed care. Barbara mentioned how people get into this often because of family or personal experiences, and that's true. My mother, I moved her in with me and my family. She lived with us for about 11 years. She watched my eldest before she went off to school, and then I was my mom's primary caregiver in her last couple of years. And that was well over 15 years ago. So back then I didn't know what I didn't know. So I've learned a lot over these years and had the opportunity to purchase HomeWell, and now I'm helping other families as if they were my own parents, and it's really gratifying. So let's see. So why plan now? To avoid crisis decision making. Oftentimes, people come to us when their family member has been in a hospital or is starting to show the signs of decline, and they need help, and it's a race to get people covered, and you want to avoid that because we don't always make our best decisions when we're in crisis mode. Then also to preserve independence and dignity. Let your family know, just like Barb said, what you want to do. Many of our clients, they want to live at home, obviously, and it's not cheap, as Barb mentioned. It is not covered by Medicare. It's out of pocket. Some Medicare Advantage companies pay. Sometimes you can get veterans benefits, and long-term care insurance policies can help. But otherwise, it's out of pocket. So, you make sure your family knows what you want, for how long, and if you need to transition to community living, then know when to make that choice before all your money runs out. To reduce stress on family caregivers. So the decision making, your kids, your grandkids, they have jobs, they have their families as well. They love you and they want to take care of you. But if you're not prepared, then it's a crisis. Ensuring the quality of life and continuity of care. So, you want to remain as independent as possible. And if you're prepared, you can ease into assistance. It doesn't have to be, all or nothing. Agencies like ours, often you can get just as little as 4 hours of help once a week, once every 2 weeks. Save up all your hard to do things and have a helper do that with you. Yeah. Recognizing the signs you may need help at home. And when I'm talking about you, this could be you, a family member, a friend, a neighbor. Increasing forgetfulness and confusion. There is normal confusion and forgetfulness. I experience that on a daily basis. But to Barb's point also, having as many people around you that see you on a regular basis or talk to you on the phone on a regular basis, they can help be a mirror for you. Changes in personal hygiene or household upkeep, collecting all the documents and never throwing anything out. There are community organizations and companies that just have to do with clutter and hoarding issues. And hoarding has a degree of, it can be way out of control where you can't walk in your house, and then that's a fall risk and you fall and hurt yourself, etc. Mobility challenges or frequent falls. take things slowly. You don't have to rush. Social withdrawal or isolation, Barb touched on that as well. And if, some people, many of us we may be inclined to hide what, is going on with us, or not be proud of it, or what have you. But, don't withdraw, don't isolate, try to connect with as many people as you can. And even Vivalon here is a good resource where if you come and you visit and you see people, and then say Carolyn's not showing up for a couple of weeks, we haven't seen Carolyn, and there can be different resources to help people stay in touch and connected. Getting the family on the same page. Many of our topics here, Barbara and I, are similar. Have open and honest conversations with your family members. Don't shy away. I know stuff's awkward to talk about your own decline or your own mortality. None of us are getting out of it alive. So even if it's hard to have an honest conversation, document it, write it down. I know that there are different kinds of tools and notebooks out there that help people document what their wishes are. So it doesn't have to be necessarily an awkward conversation. Just here it is. This is what I want. Address your concerns, your goals, your expectations. Barb touched on that. Where you want to live, how you want to live, and what you want done with all of your personal stuff. Designate a decision maker or care advocate. So Barb mentioned how we could have various family members. I've worked with numerous families with many people who were in charge, and it's easier for us as vendors when we have one point of contact. So that's usually what I ask for is, the family you figured out, and then I want the spokesperson coming to me. So then I know what decisions you've come to together. So even if you can pre-designate that with your family, okay, daughter, I want you to do this, son, I want you to do this, and hopefully they can collaborate well. Involve professionals when needed. So someone like Barb, the example was of a client that we shared. He wasn't able to pay his bills. He wasn't able to make decisions about his house and repairs that needed to be made, etc. And then, so we brought in Barb. She was able to do that. Sometimes in our situation, oftentimes I should say, is if there aren't many family members or none, we discover things that aren't happening right or decisions that aren't being made, and we kind of get pulled into it a little bit, and that's out of our scope. Talk about care management with home care, with a licensed home care agency. Generally, you have what I call baked in care management, because we communicate with the client, the family members, we talk about the care plan, we assess how people are doing on a regular basis and adjust what care and support is needed. But then we may discover things that are outside of our scope, like bill pay. We're not authorized to do that. You have to be specially authorized, as Barb pointed out. So that, or there are care management companies. So that's all they do is think of them as a hired daughter to help organize all your stuff, make your doctor's appointments and everything. Work with Barb, work with me, work with, the next vendor, the part of your team. So that's the team. Exploring your care options. So home care, there are generally two different categories. There's licensed home care, like our agency. In 2016, home care, the state of California licensed home care. And so we are licensed with the state of California Department of Social Services. All of our caregivers are our employees, and they are registered with the state as home care aides. You may run into some private caregivers that on their own volition have registered with the state, but where it finds its value is when the caregiver is then associated with their employers. And some caregivers work for numerous agencies. So they're connected with us. We get updates about them if there's any update to their criminal record. And we also are able to monitor and give them the required state training in order to be as skilled as necessary for our clients. Then there's independent hire, and the family acts as employer. So it's a misunderstanding that caregivers are independent contractors. According to both the IRS and the California EDD, caregivers are considered household employees. Because generally think of an independent contractor as more of a professional. So Barbara, an architect who's gonna fix up your kitchen, you're paying them to do a project and they're gonna do it on their time, whenever it takes to put together the designs, to get the contractors in, et cetera. A caregiver works based off of your needs, the client's needs. Well, I need help getting up in the morning, getting dressed, getting my food, making sure I take my medicines. So the caregiver works at the client's needs. Now, let's see. Then there's community-based services or facility care. So if you're living in a long-term care facility, skilled nursing, or independent senior living communities where they don't have care, but then you can hire caregivers in to work with you personally, and then assisted living and memory care. So what is a California state licensed home care organization? I touched on that. We're licensed with the state. We are required to do the Department of Justice live scan background checks, training, and insurance. So the good deal with DOJ fingerprinting is it's a living, breathing being, meaning that if Barb is my caregiver, I hired her last week, she's doing great. She goes out and robs a bank next week, and then she's convicted and found guilty of robbing the bank, then I'm notified once she's convicted. So it's not just a snapshot in time, it's ongoing. So all of the employers are notified of any changes. Then we also have initial training, 5 hours of initial training with for our caregivers, and then annual required training by the state. So, you know, we all of our agencies, we choose topics that are relevant for, you know, our clientele, for trends in the community and in health. So to make sure that we train to the needs that our clients have. Then there's oversight and regulation for quality and safety. So our care managers monitor and manage the caregivers and the relationship with the clients so that, you know, the caregiver doesn't get too embedded, that the care manager knows what's going on at all times and can be making best recommendations for our clients. Yes. Paige, want to make sure you have a microphone. Oh, did she leave? Okay. Thanks, Barb.
How would you know if the caregiver is stealing from you? How would you, the agency, know?
Right. That's a very good question, because clients, whether it's suspecting a caregiver stealing, caregiver might not be the only person coming in inside the house, because you've got a team of people, you know, a lot of helpers on your team. It can also go if a client is unhappy about the way Barb is making my meals and cleaning up afterwards. You have to tell us so we know what's going on. So otherwise we can't do anything about it. So if you notice something missing with a licensed agency, if you notice something missing, we recommend you call the police or file a report. They will investigate it. We will cooperate with the police and whatever they need to do, information about our employees. And if they're found guilty, then that's why we hold a lot of insurance. So there's liability insurance that a state licensed home care organization will hold. And that's when it would come into play if one of our employees is found guilty of a crime. The caregivers, by being our employees, they are bonded through us. Because they're a W-2 employee, we have a surety bond with the state, so they fall under that. Benefits of choosing a licensed home care agency. Safer for clients. Caregivers are screened, trained, and insured through us. We provide payroll services. We pay half their taxes, and I can't see. And scheduling is all handled for you, and the care management and oversight of their performance. Benefits for caregivers, I put down 1, 2, and 3, but I have examples of, people have explained, well, I want to hire a caregiver. She's doing the hard work for my mom. Why should it be going to a company and you, so you can, be Daddy Warbucks and make all the money off the caregiver's hard work? Well, it does cost to do business, and the oversight is important. A caregiver, we've had experiences where if it's a private caregiver, Barb might say, I can't make it on Tuesday, so I'm going to send my sister, Jenny. And your family, well, who's Jenny? Never met her. And how does she know what Barb does? And if she can even do what Barb does. So that's not good. Also, we've known people who have worked under the table, and when it's come time for retirement, there's no documentation of them having worked. So there's no Social Security money for them. So unless they're smart enough to invest the money as they earn it, there will be no work on the books for them to have Social Security. Also, another example is somebody wanted to buy a house, and when they went to try to get a loan, you haven't worked. There's no evidence of, working. So it's looking out for the caregiver also. We treat our caregivers well. We support them. There's 401k, there's training, there's health insurance, all that good stuff. They can get that through us, or, oftentimes actually through the state on the, I'm spacing on the name, but the government health insurance, it often has some really great offerings. The power of starting care early, establishing trust and familiarity with a caregiver. I even had heard over the years through people who work at assisted living places that it was their hope that any new move-ins will have had caregiving support in their homes prior to moving in, because it just makes acclimating easier, familiar with someone coming into your house, helping you, getting all up into your things and business, and helping you physically with personal care. So you can start out little. Don't wait for a crisis to happen. If you need a little bit of help, that can go a long way. easing transition if higher levels of care are needed. If mom's used to having Barb come once a week for helping her with little things, when Barb falls, breaks her hip, goes into the hospital, comes back out, needs more care, Barb's familiar with the concept of accepting help. And families often appreciate that because it provides respite for them. I know families do contribute in caregiving, but it also provides respite for them so they can rest and be a daughter, be a son, not a caregiver that's making you, you have to take a shower now or what have you. And then peace of mind for everyone involved. Key takeaways: planning early puts you in control. So same with what Barb said, documenting what you want when you want it. Home care can enhance independence, not limit it. I know with our services, we assist people, but as much as we can have our clients do for themselves, that's good because you have purpose and you have your muscle memory of doing this every day, going for a walk. And if you become a fall risk, then the caregiver is there to provide assistance and encourage you to do the things you love to do and you should do for your own health and well-being. Know your legal responsibilities. So if you are going to go the route of a private caregiver, you are a household employer, and that's okay. Just know what you're responsible for. And both the California EDD and the IRS websites have plenty of information and a whole booklet of what you would be responsible for if you are a household employer. And then licensed agencies offer safe and organized solutions. So if you're retired and that's the last thing you want to do is manage caregivers in your house, that's why you hire us. Any questions?
How much do you pay for a caregiver?
Well, that's a good question. It depends. That's the succinct. Yeah. So California recently passed a minimum wage requirement of $25 per hour for employees of assisted living, for caregiver level employees. And I'll tell you, the rates that licensed home care agencies pay are very close to that, if not the same. So and it depends on every company. Some companies pay their employees more, some less, but roughly $18 to $25, $26. It's a pretty big range, but it's within that. And that depends on the company as well. So right now, I'd say in Marin licensed home care, and there's some that are low, and then there's some that are really high. So I would say the lowest you're going to find in Marin, maybe $38 or $40 an hour. And the highest you could probably see is $60 an hour. And every company has different ways of offering their care. So, and the price. So you might get a lower rate if you have more hours. Many companies have minimums for a shift. The lowest is probably 4 hours for a shift. Shorter shifts are more expensive generally, just because it has a lot to do with staffing. In the pandemic worsened what was already a trend with a short supply of caregivers and short supply of healthcare workers. So a lot of people decided, I'm not doing this anymore. And they left the industry entirely. And caregiving, it's kind of, they move around a lot. They have family. They often are caregivers of their own family members. So they may not always be available. They'll be helping out their cousin for a year, and then that ends, and then they're ready to work for an agency. So there are a lot of factors. Is that enough is the pricing, is that kind of close? Yeah. Okay. All right, thank you. Anything else?
Thank you. Any more questions for either Barb or Carolyn?
Well, since we're talking about pricing, I was wondering, Barb, I mean, you offer lots of different things, but so what is your pricing? What is for your business?
So the question was, she wanted to know how much Barb's pricing was, or if she had it broken down into different segments of her work.
Yes. So good question. It's a range also. Daily money managers are often organizers. We do organizing work on one end, and on the other end, we do kind of the higher risk bill pay, kind of get under the hood there in a big way in terms of liability. So range would be from $90 an hour to around 150, 170. The state of California sets the rate for fiduciaries. Probate court is set. And so daily money managers are generally less expensive than fiduciaries. They're doing that day-to-day blocking and tackling, and not the estate execution, the estate planning, or the power of attorney stuff. Some fiduciaries will actually do bill pay. They work with all sorts of people, special needs trusts, people who, you might have a young son who's 30 something who needs money management, and the parents have done a special needs trust to support the child. He's out in the world, but he still can't manage everything about his life. And so fiduciaries will provide that type of service, whereas daily money managers wouldn't. So it's a range, but for me personally, it's also a range. I have several clients where I go in and just help them get the paper purged and get organized and make all those lists. And then I leave, they graduate. I have some clients who are widows, newly widowed. Inevitably, one spouse paid all the bills, didn't write anything down. The surviving spouse has no idea what to do. They're grieving, they're stressed. And so I'll come in, help them get it organized. Then they graduate because they figured out how they can work. Some people do everything online. Some people do nothing online. Usually the spouse that passes away did it all online, and the spouse that's surviving has no idea how to do it, in my experience. So there's a lot of that organizing work that's not necessarily long-term. It's kind of in and out, and then set you free. I'm in Marin, yeah. Any other questions for either of us? Oh.
Thanks, Barb.
We have caregivers for my mother now. She's almost 96. It's helpful 5 hours a day, so it's really helped. But there's always something breaking down in the house or something that needs attended to. Is there help for that?
Actually, there are a couple things that I'd suggest. Part of my business is building a team of people that help me. So I have like my favorite handyman, my favorite house painter, my favorite realtor, all the things that we all need that I'm able to call in for my clients. But Marin Villages also offers a lot of services for free, especially retired contractors and handymen. Usually Marin Villages. It's a membership. I think it's $800 a year, but there's so many different things that they offer to look into that. I'm happy to share my favorite handyman too, because it's always hard to find somebody. But that's really a lot of what both Carolyn and I run into is homes where we've got deferred maintenance and we have things we got to fix just to live there and things we have to fix to sell the house. So it isn't necessarily the hardest stuff to figure out. It's just a pain in the neck to get done. So.
Let's give another big hand to Carolyn and Barb. Thank you both for such great information. We really appreciate you coming tonight, this afternoon, and sharing your expertise with us. For everyone who's here, if you could please, there's 2 surveys, one in your seat that is for this workshop specifically. We'd love your feedback. It helps us if you have ideas for things you'd like to see in the future. So we're going to be planning our next 6 months coming up. Remember, June 18th, Carrie Spence will be here talking about wills and trust. Super important. I think both these ladies would agree that that is like a top priority. I think if you don't have one, please get one. You can use, check out our online tool called Free Will, which I'll send a link in the follow-up email, along with a recording of the presentation. And if these ladies have some handouts, I will include links to attach those PDFs so you can download those as well. I think that's it. Any questions for me about Vivalon? Yes. Oh, yes, we would love our pens back. Thank you. Appreciate that. We would love our pens back. We were a little short on pens today. This has been our largest workshop yet. So we appreciate you guys coming today. Please share it with your friends. A couple things that came up during both their presentations were things about falling. And I know my dad's had a lot of falls lately, and we have a wonderful fall prevention program and lots of classes here that are free. So if you have any concerns about that, follow up with, contact us at Vivalon, and we'll give you all the information to help you get started on those classes. We have Tai Chi, and we have a special ballet class, and we have a whole fall Mahjong. We have that too. And we have a whole falls prevention special class. So anyway, it's definitely something to be helpful. Thank you again all for coming. Oh, well, the other survey we have on the back, if you have come to Vivalon before, it's our annual survey. You could just fill it out. You can bring it back, or you can fill it out and leave it here. This helps us do kind of our bigger planning, things you really like about Vivalon, things you'd like to see change, that kind of thing. So thank you all for coming today, and we'll see you on June 18th.